What high blood sugar really does to your body after 60. High blood sugar is one of the most destructive forces acting on the aging body, and the most dangerous thing about it is that you usually can't feel it happening. No pain, no obvious warning signs, just silent, progressive damage building inside your blood vessels, your kidneys, your nerves, your eyes, and your brain, often for years before a diagnosis is made. Today, we're going to explain exactly what chronically elevated blood sugar actually does to your body after 60, organ by organ. And we'll cover the one finding that most seniors, even those without diabetes, need to hear. Welcome to Senior Wellness Guide. Before we cover the damage, it helps to understand why this becomes a problem after 60 specifically. As we age, the body naturally becomes less efficient at producing insulin and less sensitive to the insulin it does produce. Research shows that glucose levels tend to run higher in seniors, even in people without diabetes. After a meal, blood sugar peaks higher and stays elevated longer than it would in a younger adult processing the same food. This means that millions of seniors are living with what doctors call prediabetes or undiagnosed type 2 diabetes. Blood sugar levels high enough to cause damage, but not yet high enough to have triggered a formal diagnosis. The American Diabetes Association estimates that approximately 26% of adults over 65 have diabetes, and nearly half of those are undiagnosed. The first and most significant target of chronically high blood sugar is the cardiovascular system. Excess glucose in the bloodstream acts like sandpaper on the walls of blood vessels, abrading the delicate inner lining over time. This triggers inflammation, promotes the buildup of arterial plaque, and accelerates atherosclerosis, the hardening and narrowing of arteries that drives heart attacks and strokes. Seniors with chronically elevated blood sugar have significantly higher risks of cardiovascular disease, stroke, and peripheral artery disease than those with well-controlled levels. Adults over 65 are already substantially more likely to develop heart disease than younger people, and elevated blood sugar compounds that risk considerably. This is why the cardiovascular connection between high blood sugar and high blood pressure is so important. Both damage blood vessels through different mechanisms, and both are often present in the same senior simultaneously. The kidneys are among the organs most vulnerable to blood sugar damage, and the connection is direct. High blood sugar damages the tiny blood vessels inside the kidneys that are responsible for filtering waste from the blood. Over time, this impairs kidney function progressively and silently. According to the National Kidney Foundation, people with diabetes are 15 to 20 times more likely to develop end-stage kidney disease than those without it. By the time kidney damage produces noticeable symptoms, significant function has already been lost. Now here is the finding that surprises most seniors who don't have a diabetes diagnosis. Nerve damage from elevated blood sugar, called diabetic neuropathy, can begin developing at blood sugar levels below the official diabetes threshold. Symptoms of neuropathy include tingling, numbness, or burning sensations in the hands and feet, symptoms that are almost universally dismissed by seniors as circulation problems or aging. They are often early warning signs of blood sugar damage to the nervous system, occurring before a single diabetes diagnosis has been made. High blood sugar also damages the smallest, most delicate blood vessels in the body. And nowhere are these more consequential than in the eyes and the brain. In the eyes, chronically elevated blood sugar damages the blood vessels of the retina, the condition known as diabetic retinopathy. According to the National Eye Institute, diabetes is the leading cause of blindness among adults. Regular eye examinations can detect these changes before vision is affected, making annual eye tests one of the most important preventive steps for any senior with blood sugar concerns. In the brain, chronic hyperglycemia is now strongly linked to accelerated cognitive decline and increased dementia risk. High blood sugar promotes inflammation in brain tissue, impairs the brain's ability to use glucose for energy efficiently, and damages the small blood vessels that supply the hippocampus, the memory center we discussed in our walking video. Finally, wound healing. High blood sugar impairs circulation and reduces the body's ability to fight infection, meaning cuts, bruises, and sores heal far more slowly. In seniors, poor wound healing is one of the most clinically significant and underappreciated consequences of chronically elevated blood sugar. Here is the most actionable part of this video, and the one most seniors don't know about. There is a single blood test that tells you your average blood sugar level over the previous 2 to 3 months. It is called the HbA1c, or simply the A1C test. Unlike a standard fasting glucose test, which only shows your blood sugar at one moment in time, the A1C gives a far more complete picture of how your blood sugar is behaving day to day. The American Diabetes Association's 2025 guidelines recommend an A1C target of below 7.5% for healthy older adults. Many seniors have never had this test, or have had it once and don't know their result. If you have not had an A1C test recently, ask your doctor for one at your next visit. It requires no special preparation, takes seconds, and could reveal blood sugar damage that is currently happening silently, while there is still time to address it. Chronically high blood sugar damages the heart and blood vessels, the kidneys, the nerves, the eyes, the brain, and the body's ability to heal, silently, over years, often without a single symptom. The most important step, ask your doctor for an A1C test. Know your number, because you cannot protect against damage you don't know is happening. As always, this video is for education only. Please speak with your doctor about your individual blood sugar levels and what they mean for your health. Subscribe to Senior Wellness Guide for new videos every week. Drop a comment. Have you had your A1C tested? See you in the next video.